Welcome back to American Medicine Today. I'm alongside Dr. Bonati. So at the Bonati Spine Institute, you treat a condition called spondylosis. What is it, and what do people feel when they're going through it?
Well, spondylosis is a situation that happens on the joints of the spine. And that situation is associated preferentially with age. So every one of us has spondylosis. Now, the problem is this spondylosis can be a situation where you don't have any abnormalities and you don't feel anything. And you can have another type of spondylosis that is going to be so painful that it's going to keep you in bed. Spondylosis is a change on the facets. The facets are the joints of the spine. And we have spondylosis of the cervical spine, we have spondylosis of the thoracic spine, and we have spondylosis of the lumbar spine. The cervical and the lumbar are painful.
Is this something that's degenerative?
It's a degenerative problem. Older you get, more spondylosis you have. The spondylosis also is a condition that is associated with other illnesses. For example, if you have osteoarthritis, if you have degenerative arthritis, you have a collapsed disc, spinal stenosis that we treat here and that we see frequently, and what really happens is the facets are two types of a piece of bone that they rub one on top of the other one. And they have cartilage in between. If the cartilage is going to be too thin or start to have damage, then immediately you have bone and bone rubbing in that area.
Yeah, and that's painful.
That is going to create some pain. But at the same time, the pain is going to go directly to a specific nerve that is the posterior primary rami. And that specific nerve is probably the size of the width of your hair, but will create a lot of pain. It's associated with somebody who mistreats his back. For example, individuals like football players, athletes, the weekend warriors, all this group of people that they really had a lot of input on the back, like runners and individuals that lift weights and all this, they are producing a lot of pressure on those facets. And then those ones degenerate. The beginning when you're 18 or 19 doesn't happen anything, but you create the damage. The damage becomes more and more intense with age, and then suddenly that produces the pain. Another thing that we need to see is, for example, car accidents. So it's an associated type of problem because you do have the injury, and the injury is going to create some damage, and that damage ends with some type of arthritic changes. The other thing is just overweight. People that they are accustomed to carry a lot of weight on their bodies for years. In the very beginning, you have a little discomfort in the back. Usually, every one of us has the opportunity to have an injury, like when you step off the curb and twist your back. As soon as you twist your back, you have some type of a situation where now the ligaments in the bones in that area are being stretched. So this area hurt, but it hurt for a few minutes, then hurt for an hour, and then the next day is gone, and then you forgot the thing. But you already create the injury. So years after, that injury becomes now with a little pain. And initially it's a pain, very secondary to the trauma. You can have the pain for a few hours and goes away, and you never remember it again. But 5-10 years after, the same place again comes with the pain. This time you have arthritis there. At that time that you have an arthritic changes in that area, that arthritis in that area will create now a sensation, and that can be a mild sensation or can be a horrendously painful sensation, depending how the posterior primary rami of the nerve is being injured. And from that time on, then you start to look now for who's going to help you. You go to probably, for the same pain, to a general practitioner who give you some pills and forget your name. And then years after, that same pain now becomes pretty active, it's constant. You go back to your doctor, they took some x-rays, they took some MRIs, and they tell you you do have spondylosis. And then they treat you with physical therapy, they treat you with chiropractic treatments. Sometimes they refer you to an orthopedic surgeon or a neurosurgeon. Once you get at that level of neurosurgeon or orthopedic surgeon, then you have an examination that is very intense to see what needs to be done. And the surgeon looks, probably you have a bulging disc, probably you have the arthritis. Then they decide to do surgery. Now, what surgeries can be done? Now, one of the surgeries is a surgical procedure that will eliminate the facet. Another procedure was we're going to immobilize your back, and then they do a fusion. So all the things suddenly becomes really from something very simple to something extremely important. Not only because now you destroy things, now you fuse things, and the results depending not only in the surgeon, depending also how the patient, what the age of the patient is, how much motion the patient is going to do, what type of exercise is going to do, and then they can get loose all these screws, all those plates. It's more pain, it's more surgeries, more things.
So spondylosis can be treated with your patented Bonati Spine Procedures. Is that correct, Dr. Bonati?
That's correct.
If you are suffering with spondylosis and you would like more information, reach out to Bonati at Bonati.com or askbonati.com. Thank you for watching American Medicine Today. If you would like to see previous episodes of our program, search American Medicine Today on all your favorite streaming devices.